Hi everyone, welcome to Ayush TV, and this is Dr. Pavna, psychiatrist from Akshaya Medical Center, Bangalore. Today, let us know about what are psychiatric illness. What are the most common issues patients present with? In psychiatry or in a mental health illness, we segregate into what is called as a common mental illness, what we call as a common mental illness, and a severe mental illness. Earlier, it was called as psychosis and neurosis. But now, this is what a scientific classification looks like. Now, coming to severe mental illness. So, what is the severe mental illness is? You must have heard of schizophrenia, bipolar affective disorder. So, these are called as a severe mental illness. Why do they call it as a severe mental illness is? Because this is a chronic and a lifelong illness. Now, what is schizophrenia? They present with the symptoms of, it's basically a thought disorder. That is, if the person is very suspicious or not able to sleep at night, or hearing of voices, or say for example delusions, all these things come into what is called as a category of a psychosis or schizophrenia. The next is a bipolar affective disorder. As the name suggests, bipolar is either having a depression or a very low mood, or they get into mania or a very hyper mood or an elevated mood, what we can say. Now, how do they present with us? For some days they are very low, they feel very depressed, they can't carry on with their day-to-day work. These are the typical symptoms. And other few days they come up with an elevated mood. They're very talkative, they're very hyperactive, or they want to do a lot of works. So these are the symptoms what they present with. So most commonly people tend to say that during the full moon or there are mood changes. So this is what the people present with. The third one is a postpartum, what we call. That is, after the delivery of the birth of the child, usually mothers will have a presentation of having a low mood, hearing of voices, not nursing their children, their babies. So this is the symptoms what we call as a postpartum depression or postpartum psychosis. These are called as a severe mental illness and they need treatment for lifelong. Now coming to common mental illness. So what are this common mental illness? It can be somewhere from depression, where they feel very low mood, not having interest in doing anything, not feeling interested in whatever the pleasurable activities they used to do earlier, having suicidal thoughts. So this is called as a depression. The next is anxiety. Anxiety is being very perplexed. They become very anxious for a very small things. They think too much. They are overthinkers. So this is called as an anxiety. They can also be presenting with sleep disorders. Sleep is having insomnia, unable to fall asleep, or having impact on their day-to-day activities, or fragmented sleep where they get up in between. So these can be a sleep disorders. Or there could be sexual difficulties where men have a difficulty with an arousal or an erection, or female can have issues with not having an arousal. So these are the female sexual dysfunctions. Dissociation disorders or ick phobias, or as OCD, what we call recurrent and repeatedly washing their hands or thinking things are very dirty wherever they touch. There are many more like this. So this we call as a common mental illness. So as a mental health professional, as a psychiatrist, what do? We do a thorough psychological assessment for both of it. Then we start with the medications. And most of the people have this myths in them that when they start with the medications, it's a lifelong. No. We do the assessment whether it comes into a severe mental illness or a common mental illness. That is where we decide on it. And most of the common mental illness, they do not have to take lifelong. The medications are not warranted lifelong. But getting professional help is very, very important. When you get a professional help, we have a holistic approach in treating the patients, so that the disability of whatever has been caused in their life due to this kind of an illness can be reduced. So if you have any comments about any mental health issues or anything, you can please comment us in a comment box, and also like and subscribe our channel. Thank you.